clear registered nurses are central to aged care. It's imperative that staffing in our aged care setting adequately meets the needs of residents and is of a high skill mix to deliver the care required.
I'm at State Parliament of New South Wales, and this morning we had the handing over of 10,000 signatures of the petition to make sure that we retain registered nurses in our nursing homes 24/7.
And I think it's a really important issue that we're hearing about here today, and I think the government should take notice.
The care needs of vulnerable nursing home residents are not confined to business hours. That's why people go into a nursing home in the first place. They need round-the-clock care by highly skilled professionals.
It's not a stage we want to get to, but I think as we all get older, we start realising the people we visit may be us in the future.
I think they're losing sight of what the word care means if we don't have registered nurses.
And we want to be not put in a nursing home as a parking station, but a nursing home to be nursed, to be cared for.
A decision which currently rests with the Minister for Health will be made in the coming months on whether or not to keep the minimum requirement for a registered nurse to be employed around the clock in aged care settings.
Registered nurses need to be on duty in nursing homes. They have the skill and expertise to be able to assess and manage and respond to changes in the elderly.
We know for a fact that most people that are going into these facilities are requiring high level entry.
Many of the people we look after are on more than 10 medications, and we know that those medications lead to side effects which can be very detrimental. They have many comorbidities. They have lots of different illnesses at the same time.
So if we don't have RNs to help support the high level care of complex patients, or residents I should say, then I don't know how they're going to be able to remain in aged care facilities.
We cannot rely on industry self-regulation for our most vulnerable Australians. Though many service providers will do the right thing, we need to make sure that they all do.
My wife, we've been married 55 years, she has dementia and is full-time in a nursing home. So I decided I'd have to do what I could. Found out about the petition, and since then I've got 1,163 signatures, plus 32 more yesterday, and I will keep getting those signatures because I don't care how much time I spend. This whole subject's just too important.
Are registered nurses really essential? Very short answer, yes.
There needs to be 24/7 RNs in facilities, but to go in further I would like to look at ratios in aged care facilities. That's a big concern as well, I think.
Last night at Leichhardt Council we were able to move a resolution unanimously supporting this campaign and the need to keeping registered nurses in nursing homes.
So I encourage you all to continue your efforts to lobby members of Parliament.
I will very proudly table this petition in the Legislative Assembly. All residents in New South Wales nursing homes and aged care facilities should be provided with quality care led by registered nurses. Full stop.
RNs 24/7.